The palpable, heavy anxiety that instantly settles into the chest the moment one steps into a brightly lit, cold, and sterile medical waiting room simply for a yearly wellness checkup, only to leave holding a massive, intimidating stack of diagnostic orders and specialist referrals, is a deeply universal and entirely exhausting experience for millions of older adults who simply want to live their golden years in peace. For decades, the modern medical establishment has aggressively promoted the seemingly logical idea that more testing, more screening, and more relentless bodily surveillance is the absolute, unquestionable key to a long and healthy life, completely ignoring the profound, undeniable truth that an aging body possesses an entirely different biological landscape than a young one, and subjecting it to constant, hypervigilant poking and prodding often causes infinitely more harm than good. A profound, rarely spoken truth whispered among the most compassionate, highly experienced geriatric physicians is that the single most difficult, masterful art in modern medicine is not knowing how to violently intervene, but rather possessing the deep, patient wisdom to know exactly when to do absolutely nothing at all. A concept that completely directly opposes the modern medical machine that is fundamentally designed to find something, anything, to fix. When an individual crosses the threshold of 65 and gracefully moves into their 70s, the body should no longer be aggressively measured against the perfect, pristine, mathematical charts designed for a 30-year-old, because tiny anomalies, harmless biological noises, and slow-growing cellular changes are entirely natural, completely expected parts of the aging process, not terrifying emergencies that demand immediate surgical war. The true profound danger of routine overtesting lies in an insidious, devastating phenomenon known as the medical cascade, where a completely harmless routine screening accidentally uncovers a tiny, insignificant biological shadow, which instantly triggers a massive wave of intense psychological terror, followed immediately by highly invasive, deeply painful biopsies, dangerous chemical treatments, and unnecessary surgeries that absolutely destroy the delicate health, the immune system, and the precious peace of mind of an older adult who was feeling perfectly fine just a week prior. The goal of wise, mature healthcare must always violently shift away from merely trying to extend the absolute quantity of days on a calendar at any physical cost, and move entirely toward fiercely protecting the supreme quality, dignity, and independence of the life being lived right now, which means learning how to confidently, respectfully, and safely decline specific routine medical interventions that the system automatically tries to push. One of the most glaring, physically brutal examples of this automated medical overreach involves the routine screening colonoscopy, a procedure that is highly valuable for a 50-year-old, but becomes incredibly questionable and often downright dangerous when routinely pushed upon individuals who have already celebrated their 75th birthday. The medical industry often downplays the severe physiological toll of the preparation phase, completely ignoring the fact that forcing an older, delicate body to consume gallons of harsh chemical laxatives while simultaneously starving it of vital nutrients for 24 hours causes a massive, highly dangerous shift in electrolytes, severe, life-threatening dehydration, and incredible physical exhaustion that can take an older adult weeks to fully recover from. Furthermore, the biological reality of colon polyps is that they are incredibly slow-growing entities, often taking 10 to 15 entire years to eventually develop into anything truly threatening, meaning that discovering a microscopic polyp in an 80-year-old offers absolutely zero practical benefit to their immediate health or their long-term survival, while simultaneously exposing them to the incredibly real, immediate, and potentially lethal risks of being placed under general anesthesia and suffering a catastrophic bowel perforation from the rigid scope itself. Stepping away from this exhausting, dangerous procedure when asymptomatic is not a denial of health, but a wise, protective choice to preserve the integrity of the digestive tract and avoid a traumatic medical cascade that serves no life-enhancing purpose. Moving directly into another incredibly common, yet highly controversial and deeply misunderstood screening, the routine PSA blood test for prostate health stands as a monumental example of a simple needle prick that routinely destroys the peace of mind of millions of older men. The prostate-specific antigen test is notoriously incredibly sensitive, meaning that it frequently registers alarmingly high numbers for reasons that have absolutely nothing to do with cancer, such as a harmless urinary tract infection, a recent physical exertion, or simply the benign, entirely natural enlargement of the prostate gland that occurs in almost every single aging male on the planet. However, the moment that little number appears flagged in red on the laboratory report, the automated medical cascade instantly activates, plunging the individual into a terrifying psychological nightmare that almost inevitably leads to an aggressive, highly invasive, and deeply painful prostate biopsy, a procedure carrying a massive, genuine risk of causing a severe, life-threatening systemic infection or sepsis. The tragic irony, recognized by top oncologists worldwide, is that even when these biopsies do happen to find cancerous cells in an older man, the vast majority of these specific tumors are so incredibly sluggish, indolent, and slow-growing that the man would comfortably live out the rest of his natural life, happily enjoying his family and his hobbies, and eventually pass away from entirely unrelated causes without ever even knowing the cells were there. Forcing an older man to undergo radical prostate surgery or devastating radiation for a harmless, dormant cluster of cells permanently destroys his urinary continence, obliterates his vital dignity, and ruins his daily quality of life, all to cure a disease that was never actually going to hurt him, making the routine checking of the PSA a dangerous trap but invites completely unnecessary suffering. Similarly, the psychological landscape of routine mammography for women advancing into their late 70s and 80s is fraught with a deeply terrifying, emotionally agonizing phenomenon known as the false positive, a devastating phone call from the clinic demanding that the woman return immediately for more imaging because the machine detected a highly suspicious shadow. The profound, heart-stopping terror of waiting weeks for a biopsy result completely shatters the nervous system, drastically elevating cortisol levels and destroying the immune system of an older woman, only to finally be told that the shadow was merely harmless dense tissue or a benign cyst, a terrifying ordeal that the medical system dismisses as a minor inconvenience, but which the patient experiences as deep psychological trauma. Even in the instances where a routine mammogram in a very advanced age group does detect a small anomaly, the biological truth mirrors that of the prostate, where these late-in-life cellular changes are overwhelmingly slow-growing and completely non-aggressive, entirely unlikely to ever cause physical symptoms or threaten the life of the woman. Subjecting an 80-year-old breast to harsh, burning radiation therapies or completely unnecessary surgical lumpectomies to eradicate a microscopic dormant shadow inflicts massive, immediate physical devastation, severe chronic fatigue, and a loss of independence that is infinitely more threatening to her daily survival and happiness than the silent cells the machine accidentally found. The dangerous obsession with forcing the aging body to perfectly match the numbers on a standardized laboratory chart leads directly to the fourth, highly questionable, incredibly dangerous automated medical practice, which is the aggressive, relentless pursuit of perfect blood sugar and strictly low A1C targets for older adults. The medical system frequently attempts to aggressively medicate a 75-year-old until their blood sugar matches the exact pristine levels of a healthy 30-year-old, utilizing massive doses of synthetic insulin or harsh oral medications that force the numbers down rapidly, completely ignoring the massive lethal danger that this aggressive approach creates. While mildly elevated blood sugar poses a slow, theoretical risk of complications decades down the line, an aggressive medication that suddenly pushes the blood sugar too low creates a terrifying, immediate, and highly lethal condition known as hypoglycemia, which causes sudden, extreme dizziness, total confusion, and catastrophic fainting spells. When an older adult experiences a sudden hypoglycemic blackout and falls onto a hard bathroom floor, the resulting fractured hip, shattered pelvis, or traumatic brain injury instantly strips away their precious independence, frequently leading to a permanent transfer into a long-term care facility and a rapid, tragic decline in overall health, making the aggressive treatment of the blood sugar infinitely more deadly than the slightly elevated sugar itself. Wise, compassionate geriatric medicine deeply understands that allowing the A1C to run slightly higher in the golden years is not a failure of care, but rather a brilliant, highly protective strategy designed explicitly to prevent the devastating, life-ending falls that completely destroy an older adult's physical autonomy. Finally, the seemingly harmless, entirely painless, routine electrocardiogram, commonly known as an EKG, performed as a standard baseline on a perfectly comfortable, active individual who has absolutely zero chest pain, zero shortness of breath, and zero symptoms of cardiac distress, acts as the ultimate, classic trigger for the most exhausting, unnecessary medical cascade of all. The modern EKG machine is incredibly overly sensitive, designed to pick up the tiniest, most microscopic electrical variations in the heartbeat, meaning that it frequently flags completely harmless, benign electrical murmurs or slight age-related shifts in the rhythm as terrifying, abnormal cardiovascular events. Because modern doctors are terrified of legal liability, this meaningless, harmless electrical blip automatically forces the physician to order a massive battery of deeply exhausting, anxiety-inducing secondary tests, forcing the perfectly healthy older adult to walk on a steep treadmill until their lungs burn, or injecting them with harsh, nauseating chemical stress agents to artificially force the heart to race, completely terrifying the patient. This cascade often ends with a highly invasive angiogram, where a wire is literally threaded into the heart and harsh chemical contrast dyes are violently blasted through the arteries, dyes that are notoriously toxic and deeply damaging to older, delicate kidneys, completely jeopardizing the individual's renal function, all because a highly sensitive machine detected a harmless background noise during a routine checkup. The ultimate profound realization that absolutely changes the entire trajectory of the aging process is understanding that the individual is not a helpless passive subject on a medical assembly line, but rather the powerful, fully autonomous chief executive officer of their own magnificent body, possessing the absolute, undeniable right to question, to pause, and to respectfully decline any procedure that threatens their peace of mind. Stepping out of the exhausting cycle of medical fear requires simply looking the physician respectfully in the eye and asking the single most powerful, clarifying question in all of modern healthcare. Doctor, if we perform this test and find an anomaly, how will the subsequent treatment actually change and improve my daily quality of life right this very minute? If the honest answer involves vague promises about distant statistical risks, accompanied by immediate, guaranteed physical suffering, pain, and a massive loss of daily independence, the wisest, most fiercely protective medical decision an older adult can ever make is to gracefully walk away, choosing to completely prioritize the joy, the comfort, and the absolute peace of the present moment over the terrifying, endless search for invisible phantoms. If discovering these deeply hidden, vital biological truths, exposing the exhausting traps of the automated medical system, and learning exactly how to fiercely protect the aging body from unnecessary harm, brings a wonderful sense of profound hope, immense relief, and true empowerment to the beautiful journey of aging gracefully, making the firm choice to subscribe to this channel will ensure that these life-saving secrets, honest health conversations, and powerful natural wisdom continue to light the way toward a significantly calmer, deeply protected, and far more vibrant life.